Hi and welcome to another video from the CTAG Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. Today I'm going to be looking at some questions that have been posed by quite a few people within the comments section of the channel, and that is trying to understand the behaviour of alters. So this is really specific to dissociative identity disorder, or DID as we'll call it. It's also present in other specified dissociative disorders because people often don't really understand why alters might be doing the things that they're doing or influencing the way that they are. But it's much more obvious within DID because of the actual behavioural changes. So often it's seen as the way alters might be treating other people, might be treating the person, or treating or reacting or responding to the environment around them. It's a very, very complicated issue. As with all things, this is much best done with a therapist, and I'll explain why a therapist can really help with this. But actually what I'm going to be looking at today is much more sort of the internal inquiry that can take place from an individual trying to work out what their alters are doing. Obviously, what I can't do is give explanations to each and every person as to why their alters are doing those specific things, because it's so context dependent. Each and every person is different, each and every alter is different. There's no way of really being able to understand why an alter might be doing something on a small amount of information left on the YouTube channel or in an email or something like that. So for that reason, I tend not to offer that stuff because it's largely guesswork. And what we want to do is have a clear framework of assessment and understanding within which to do this much more formally. That gives the greatest chance of accuracy, which means that we might be right, which means it leads to an action as to what to do. If we make a guess and we guess it wrong and you try and do something in response, it could go wrong, and that could be quite, potentially dangerous, but it could also just be quite upsetting, distressing, or create more disharmony within the system than already exists. So I hope that's okay, that I don't respond to those individual things because it's not really viable for me to do that. But what I'm going to try and do today is just give an overview on the framework within which somebody in my position, a therapist, a clinical psychologist, so I'm doing this work with people to try and break down and decode the behaviour that an alter is presenting in a way that can then be helpful and encourage the person and the alters and the entire system to be able to manage, contain whatever that behaviour is, and ideally work it to an advantage, because there's often a usefulness to every behaviour, even if that's not what it feels like at the time. Realistically, what we're looking at then is observed behaviour. So it's the sort of things that are being said or being done in response to events around in the world. Sometimes the behaviour is helpful, sometimes the behaviour might be unhelpful. Again, it all depends. What we work on the basis of is that there is a traumatic cause underlying that behaviour somewhere. Now, it could be that that behaviour and that traumatic cause are very, very separate in terms of time. So a person might have experienced a traumatic events or series of events early in childhood, and the behaviour from the alter might be presenting 20, 30, 40 years later. So there's this enormous time gap in between. And actually how the initial design of that alter within the traumatic experience taking place has morphed or evolved or changed into the behaviour that's in the present day, an awful lot could have taken place. So trying to really get to grips with that is a very complicated process, but it's not an impossible one. It's something that can be done, and if you approach it in the right way, it can be very meaningful. The premise is that the design was set up in childhood, but what we generally are seeing is that the behaviour is then being experienced in adulthood. That gap is what really, really counts. Now, sometimes it doesn't. Sometimes it's really, really obvious, but I guess you wouldn't be asking the question, what is going on, if it was obvious. This is for the ones where it's not obvious. So it tends to be that evolution has taken place somehow. What was initially required by the brain to manage in childhood has then changed into something else in adulthood because the person's circumstances are different, but the alter, the design might not be. So your life may have changed from being, say, 5 or 10 to being 25 or 30 or 45. Clearly there are going to be differences in your life, but the actual design of the alter is then trying to deal with issues in the present from a design that was set up in the past. I hope I'm not being too confusing about that. It's really trying to understand that something that was meaningful then isn't meaningful later on 20, 30 years ago, but the brain is responding with that behavior, with that alter, as if it is still meaningful. So the brain gets tricked. And that's really where we see a lot of this stuff happening. The alters are behaving in ways they don't necessarily need to behave, but that was the design or the role that was assigned to them many, many years ago, and they're enacting that pattern of behavior. Once you get your head around that, you realize a lot of it isn't personal. It can be feel very personal. Let's say if you're being insulted or hit, or other people are being affected negatively, feels very personal. But the brain isn't doing it to be personal. The brain always has an underlying logic to whatever the design of that alter actually is. Once you've got your mind set within that, you can then assume that detective role. You can be curious about the nature of the behavior rather than critical of it. It's too easy a step, and it's a trap to fall into, to say, I don't like the behavior, therefore I want to get rid of it. It's causing me problems, it causes me difficulties, I'm losing money, I'm losing friends, I can't keep a job, whatever it might be. And to just want to get rid, to push that away and say, I want nothing to do with it, it's awful, it's horrible, it's just a nightmare, and I need to get rid of it. That doesn't solve the problem, because the brain doesn't really work in response to that. It's not just going to remove that behavior or that alter because you don't like it. If anything, it will ramp up, get worse, and you're left with all the problems. So taking that curious step is absolutely critical. That allows us to ask the questions, and it's these questions that help us decode that behavior, break it down, and make sense of exactly what it is. Okay then, so if we're thinking about the questions, we work on this basis. Whatever the behavior is doing would have made sense at some point. So this is how we would approach it in the therapy setting. Some of the key concepts then, if I work through a list of questions, if you like, what I might do, this is a very complicated topic. I'm not going to cover it all in one session. It would be far too long a video. So I'm probably going to break this down in a series of videos as we go along. So I hope that's okay. So for the moment, maybe the best thing to do is just start with a list of the key questions, because that gives you a framework to start with if you want to start applying this. By all means, right? Ideally do this with a therapist, but just asking these questions of yourself, having a note paper, having the stuff written down, that should be okay to just try and work out what information have you got. We're not talking about doing anything about it, we're just talking about gaining information. If by asking some of this information of yourself, it creates distress, it creates trauma, it creates traumatic intrusions, then stop, because there's no point. You need to do this in an environment that is safe and calm to do so. And when you actually start asking the questions, what you get is positive information. You don't become overwhelmed, then you can proceed. I hope that's okay. So some of the questions we're looking at then. The first is the age of the alter. So what is the age of the alter that you're aware of that is working on this? Because that sometimes helps us understand at what point in your life was that alter created. If you have a 5-year-old part that is creating havoc in your daily life now, the likelihood is that around the age of about 5, that alter is being created. So that gives you a sense of how old you are, how long that alter has been around, and how long they've been behaving. In addition, we also think about defining characteristics. So gender, obviously we've got age, we've got gender, we've got things that they like doing, things that they don't like doing, times in which they might come out. So what is the occurrence of that behavior? Is there a particular pattern? Is there a particular sequence of events that brings that alter to the fore, and then that behavior comes out? Additionally, are there times when that alter is present and that behavior is not happening, versus times when the alter is out and that behavior is happening? And then when the alter is not out, what is going on that means that they're not out at all? So you break down the context of the behavior. So we have age, defining characteristics, and the sequencing of events, the context in which that behavior is taking place. We need to know the level of communication. Are they verbal? Are they non-verbal? Are they actually able to tell you? I mean, the simplest thing to do is ask, why is that behavior happening now? What is it that you think you're doing with that behavior? If they're verbal, if they're communicative, you might get some argument, you might get some debate, you might get some reasoning behind it. If they're not verbal or they're not communicative, it's all this guesswork. So it depends what you've got. Then we look at the behavior and think, well, what is it that the brain might have needed that behavior for? So if it's, say, a very critical, insulting or aggressive type behavior that's taking place, try not to just go, I hate that and I don't want it. Try and think, what is it that the brain might have needed a level of aggression or criticism in order to achieve. Try and think about the principles of logic. The behaviour has to have meaning. What could that meaning actually be? That's what we look at as being the underlying cause. Whatever the behaviour is doing has probably got a manifestation underlying it that has some sort of traumatic aspect or connection to it. So for example, if you have a part that's being particularly aggressive, it could be that they're guarding something like a secret. Or it could be that if they're being particularly, let's say, clingy, or they are desperate for connections or contacts with somebody, it might be that that's to overcome loneliness. It could be that whenever the lights go out, that the behaviour is enacted, because that could be a fear of the dark. So the impact of their behaviour is probably what's causing the problem, but there might be a very simple explanation for the underlying cause located within trauma. This isn't trauma work, so this isn't about then going back into the trauma and making sense of it. That's not a good idea at this stage. All we're trying to do is gain a sense of what the design of that behaviour may originally have been there to do. Is it to protect? Is it to overcome difficulty? Is it fight? Is it flight? Is it freeze? Is it fawn? Is it all of those things? So you're trying to break down the material of the behaviour and decode it into one of these principles of need at the time that the behaviour was being designed initially by the brain. Another good example, you might have an alter that goes out and shoplifts, but it could be that that's to overcome a principle of hunger, that the part was designed to gain things that weren't there, such as food, but actually it's continuing to be enacted. You go into a supermarket and you might find you're putting stuff in your pocket, creates a lot of problems. You've got to take the stuff out, you've got to give it back to the shop. And you're really angry that that part is stealing things and you push that part away. But what if the design of the part was to overcome hunger, malnutrition earlier in life? That would be fair enough, but the behaviour is continuing to manifest itself clearly in a way that is not then particularly helpful. We would then say that that's the difference between an adaptive behaviour early in childhood that has morphed into a maladaptive behaviour later on in life. And I think if you start with those principles, if you start looking at any behaviour and you try and break down that behaviour into these kind of different characteristics, get as much information about the behaviour as you can, or what you might know, what you might remember, what people are telling you. Try not to bring too much emotion into this. Approach this on an intellectual basis. Be a detective trying to look at the clues at the scene rather than be the person who that event has happened to, which is much more emotional. If you can be intellectual about this, the clues are likely to be there. As a therapist, as a clinical psychologist, I approach it in this way. I always get the person to describe things and I ask loads and loads and loads of questions to try and decipher the code, because the answers are nearly always there. Not always, sometimes it's just a puzzle I haven't solved, and that might be because I'm not good enough to solve it and somebody else might have a better job, or it's so buried that you just can't figure out the clues. But if we work on the basis that there is an underlying reason, there will be a logical cause, you approach it with curiosity, intellectual questioning, ask the questions, write the answers down, look at the patterns, the answer might present itself. And you'll kind of know if you've got the right answer because you might get a very positive emotional reaction. It might feel that alter has suddenly been heard, or you might get a pushback. They don't like being heard, they feel that's intrusive and they push you back in some form, or it might be that you hear or feel a great sense of relief. One of those things are likely to tell you that you might have got something right. That's really useful. So if you're able to work on these principles, think about these principles, approach it very carefully, be mindful of yourself, don't get overwhelmed, don't go too far, don't go too quickly, just be very gentle in the questioning process, as would happen in therapy. It might be that you get some results out of this. Okay, so key principle then, trying to understand the behaviour of an alter, we have to decode, do detective work, try and build that understanding. If you're able to do it, you might get an emotional reaction to tell you that you're right or that you stepped on too many toes. Back off. I hope this has been helpful. I will do more videos. I'll probably create a mini series of things about this because it's such a wide topic. So this is a good starting point. Thanks very much for listening. As always, leave comments, like, subscribe, sign up for the notifications. We'll keep producing the content, and I hope you keep enjoying watching these videos. So before the next one, please do take great care.